In our current period, medications play an indispensable role in the maintenance of our health, yet alongside their benefits, they also carry with them subtle but significant risks. As we advance in age, the efficiency of our kidneys tends to decline, emphasizing the need to reduce our exposure to detrimental chemicals and pharmaceuticals. However, this task is particularly challenging due to the prevalence of a growing number of health complications and medications that often accompany the aging process. Specific medications possess nephrotoxic properties, indicating that they have the potential to cause harm to the kidneys either directly or indirectly. This harm diminishes the kidney's capacity to effectively filter blood, leading to the accumulation of harmful waste substances and the onset of severe health conditions. The severity of kidney damage is typically assessed across various stages, ranging from mild dysfunction to complete organ failure. The likelihood of drug-induced nephrotoxicity escalating is notably higher in individuals of advanced age and those with pre-existing kidney ailments. Notably, there exist two primary forms of kidney damage attributable to medications: dose-dependent toxicity, where the extent of harm corresponds to the dosage administered, and idiosyncratic toxicity, a variant that is erratic in nature and manifests differently among various individuals. Nephrotoxicity, resulting from medications, can stem from issues such as the breakdown of muscle tissue, rhabdomyolysis, the necrosis of kidney tissue, renal infarction, and the accumulation of acids, renal tubular acidosis, ultimately leading to diminished kidney function and the appearance of additional complications such as nephrotic syndrome or imbalances in electrolytes. Within the context of this video presentation, we will delve into the repercussions of commonly used medications on kidney health and offer valuable insights for the safe management of these pharmaceutical agents. Acquiring an in-depth understanding of these potential risks can empower you to make well-informed decisions regarding your health care. We would like to highlight that all the information conveyed in this video has been meticulously curated by human experts for human audiences. Our content undergoes thorough fact-checking procedures, remains free of bias, and undergoes scrutiny by qualified professionals. It is important to note that artificial intelligence writing tools like ChatGPT have not been employed in the generation of this content. 7. Antibiotics. Antibiotics are often prescribed for infections, but they come with risks. Antibiotics, also known as antibacterials or antimicrobials, combat bacterial infections by either killing bacteria or preventing their reproduction. Common antibiotics include ciprofloxacin, Cipro, amoxicillin, Augmentin, metronidazole, Flagyl, and trimethoprim, sulfamethoxazole, Bactrim. These drugs treat various infections, such as strep throat, pneumonia, urinary tract infections, UTIs, and skin infections. However, antibiotics can't treat viral infections like colds, flu, bronchitis, most coughs, and sore throats. Misuse can lead to side effects including diarrhea and liver and kidney problems. Even when used correctly, some antibiotics like polymyxins, aminoglycosides, and vancomycin can harm your kidneys. These medications can damage kidney cell membranes, accumulate in kidney cells causing cell death, and harm kidney tubules through inflammation. Nearly 1/3 of antibiotics prescribed in the United States are inappropriate, according to the CDC and a study published in the Journal of the American Medical Association. Before taking antibiotics, it's essential to confirm their necessity with your doctor and follow dosage instructions precisely. Never save antibiotics for future use or share them with others, as prescriptions are tailored to individual health needs. 6. Nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs, such as ibuprofen, aspirin, and naproxen, are commonly used to ease headaches, sprains, strains, colds, flu, and arthritis pain. They work by blocking an enzyme called cyclooxygenase, COX, which helps produce pain-causing substances. However, COX also protects the kidneys during stress and helps regulate sodium and water excretion. Blocking COX can narrow kidney blood vessels, reduce blood flow, cause fluid retention, high blood pressure, and even acute tubular necrosis, where kidney tubules die due to lack of oxygen, and acute kidney failure. Prolonged NSAID use can trigger inflammation in kidney tubules, affecting 1% to 5% of daily users worldwide. A 2006 study published in the Journal of the American Society of Nephrology found that NSAID use raised the risk of acute kidney injury, AKI, by 26%, especially within the first 30 days of use. Another study showed that patients with chronic musculoskeletal pain who took NSAIDs had decreased kidney function after NSAID use, but returned to normal after switching to another pain relief 5. Diuretics help with conditions like fluid retention, often seen in heart and kidney failure and liver cirrhosis. Common diuretics include hydrochlorothiazide, HCTZ, bumetanide, Bumex, furosemide, Lasix, spironolactone, aldactone, and acetazolamide, Diamox. They increase urine output and expel excess salt in water, helping with hypertension, a leading risk factor for kidney disease. While diuretics are generally suitable for your kidneys, excessive use or high doses can lead to dehydration, a risk factor for kidney damage. A study from 1999 to 2010 found that diuretic use was linked to higher rates of kidney disease and risk factors like hypertension and diabetes. Regular checkups, staying hydrated, and monitoring electrolytes and kidney function are crucial for those taking diuretics. 4. Proton pump inhibitors, PPIs. PPIs, such as omeprazole, Prilosec, and esomeprazole, Nexium, treat conditions like gastroesophageal reflux disease, GERD, by reducing stomach acid production. However, PPIs have been linked with acute interstitial nephritis, AIN, a kidney disorder characterized by inflammation in the spaces between kidney tubules. Long-term PPI use may lead to lower kidney function, AKI, and chronic kidney disease, CKD. A 2019 cohort study in the Journal of Pharmacotherapy found that PPI use increased the risk of AKI and CKD. Regular checkups to monitor kidney function and magnesium levels are essential for those taking PPIs. 3. ACE inhibitors. Angiotensin-converting enzyme, ACE inhibitors, such as lisinopril, Zestril, and enalapril, Vasotec, lower blood pressure and manage conditions affecting the heart, blood vessels, and kidneys. ACE inhibitors help relax blood vessels, lower blood pressure, and reduce stress on the heart. They also improve blood flow to the kidneys, protecting them long-term. However, mixing ACE inhibitors with NSAIDs and diuretics can increase the risk of AKI. Patients should consult their doctors to lower this risk. ACE inhibitors may decrease the estimated glomerular filtration rate, eGFR, indicating reduced kidney pressure, not necessarily kidney trouble. Regular kidney function checks and adjusted dosages are essential. 2. Antiviral drugs. Antiviral drugs treat serious or long-lasting infectious diseases like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. While effective, these drugs can harm the kidneys through direct toxicity or crystal buildup, causing kidney stones. For example, remdesivir for COVID-19 contains a substance removed by the kidneys, which might build up and cause kidney toxicity in people with kidney issues. Other antivirals like cidofovir, adefovir, and tenofovir can cause acute tubular necrosis or inflammation in kidney tissues. Close medical supervision and consistent use are crucial to mitigate these risks. 1. Lithium is a prescription medication for mood stabilization and certain mental illnesses, such as mania and bipolar disorder. While lithium can stabilize mood, long-term use can lead to serious kidney issues, including nephrogenic diabetes insipidus and end-stage renal disease, ESRD. Early kidney damage from lithium might be reversible, but could become permanent over time. Patients on lithium should maintain a regular diet with enough salt and fluids, get yearly blood tests, and seek medical help if anything seems wrong. Regular monitoring and careful dosage adjustments are vital to prevent kidney damage. Extra tips for cautious use. If you suspect that your medication is affecting your kidney health, seek medical advice immediately. Symptoms of kidney failure might not be apparent initially, but become more evident as the condition worsens. Regular kidney function tests, proper hydration, and awareness of potential drug interactions are essential for those at risk. Medications are essential for treating various medical conditions, but certain drugs pose significant risks to kidney health. Patients with existing kidney disease or those predisposed to kidney disease should work closely with healthcare providers to select treatments that minimize risk, adjust dosages, and monitor kidney function regularly. Adopting a healthy lifestyle, including a balanced diet and regular exercise, can help reduce medication use and protect your kidneys from damage. Stay informed and proactive about your kidney health. For more information on how to protect your kidneys and understand your body better, make sure to subscribe, hit the bell icon, and turn on all notifications. If you enjoyed this video, check out our other content on harmful habits for kidney health and tips to avoid them. Stay informed, stay healthy.